All right, everyone. We are going to start, this review will be on muscles. And these are different types of questions that have shown up in the past on some past exams. Some of these do get recycled every now and then. They may not be, you may say, oh, you know, that one wasn't on the test, and that's okay. It may be a question that may help us guide us to studying and preparing for other muscles that you may see on the lab exam. So let's take a look at this first question. Now, this one here should be a little bit familiar because this was a histological slide that we did when we covered tissues. And when we covered tissues, we knew that there was connective tissue and epithelial tissue and muscle tissue and nerve. And under muscle, there was skeletal muscle, smooth muscle, and cardiac muscle. The two that had a very striated appearance were skeletal and cardiac. So here we're looking at cardiac muscle. Okay, so that's part of it. And it just wants to know what this blue dot is, or what this highlighted portion is. And all of these highlighted portions that we see here are nucleuses of cardiac muscle fiber. If it was an intercalated disc, those are these lines that are running perpendicular. Remember, the intercalated discs are where cardiomyocytes or muscle fibers come together and join. And if we open them up and look inside of those intercalated discs, we would see gap junctions. Those are the type of junctions that brought the heart cells together. All right, so that would be the nucleus. Now, this was one that showed up on a past exam as well. Again, it's cardiac muscle, right? If we look at the choices, we go, all right, is a cardiac muscle fiber? Is it a nucleus of a cardiac muscle fiber? Is it a perinuclear cytoplasm? Well, right, we can eliminate that. That has nothing to do with the rest. Is it an intercalated disc? Nope. This is an intercalated disc, and this is an intercalated disc, and this. So now it's branches of the cardiac muscle fiber, it's cardiac muscle fiber, or it's the nucleus. And what it's showing is the branches. These are branches of the cardiac muscle fiber. All right, let's just skip ahead, and now let's look at the skull, because there are many skull muscles and facial muscles to be familiar with. Now, this happens to be one of the muscles of mastication. What are the muscles of mastication? Muscles of mastication, let's see if I can draw on this here. So hopefully you can see it. Well, no, let's see, it's not catching. Let's do the pen here. Here we go. So what I'm writing here is this mnemonic called time, T-I-M-E, and the T is for temporalis, the M would be for masseter, and then the I and the E stand for internal and external pterygoid. And pterygoid is spelled P-T-E-R-Y-G-O-I-D. So there's an internal pterygoid, and then there's an external pterygoid. I'm just going to put PT here for short. P-T-E-R-Y-G-O-I-D. Okay? Now, sometimes the internal pterygoid is called the medial pterygoid. And sometimes the external pterygoid is called the lateral pterygoid. Okay, so 4 muscles of mastication. What does mastication mean? It means that they are muscles of chewing. They are the temporalis, the internal pterygoid, the masseter, and the external pterygoid. And again, sometimes internal is referred to as medial, and external is referred to as lateral pterygoid. They are interchangeable, but they are muscles that will move the mandible to help you chew. So this one here that we can see is next to what bone? Well, this bone right here is the temporal bone. So this is the temporalis. Remember, muscles can be named by the bones that they are next to. So if there was a muscle here, it's the frontalis. And if there was a muscle back here, it is the occipitalis. Okay. All right, so now it takes us to the back of the head. Now let's take a look at some of the choices and see if we can figure this out. All right, so trapezius. This looks a little bit too small. Well, let me go back here, see if I can put on the pen again. So this looks a little bit too small here and here for the trapezius. We can cross that out. Temporalis, I think we can cross that out because we're looking at the back. Rhomboid. Well, rhomboids, I'm going to draw a scapula here, and I'm going to draw another scapula here. The rhomboids go from the spine to the scapula on both sides, like this. Okay, and that would be rhomboid minor, and then rhomboid major would be a little bit lower. Okay, so one of these on the top, that would be rhomboid minor. That goes from C7 and T1 vertebra to the vertebral border of the scapula. Okay, rhomboid major goes from T2 to T5. Spinous processes, also to the vertebral border or medial border of the scapula, but they go on this diagonal. They make a shape of a rhomboid when they're combined. So now we have, could it be levator scapula? Well, it's got the word scapula in it, and it's not attaching to it. Well, it would have to be the occipitalis, okay, because it's back near the occiput bone. All right, let's look at this muscle. Even if you don't know it, let's look by process of elimination. Well, we see in orbicularis and we see in orbicularis. Sometimes they put both of these there as choices to trick you, but now we have to choose. Maybe it's one of these or the other. Maybe not. Well, let's just rule out the others. Rhizorius? No, it's not rhizorius. That one's like over here. Could it be the mentalis? Well, no, mentalis is near the mental bone, right? The mental protuberance of the mandible. Could it be the zygomaticus major? And if there's a zygomaticus major, there's going to be a zygomaticus minor, but that's near the zygomatic bone. That's over here. Now we have to choose between orbicularis oculi or orbicularis oris. Oris means oral. This would be orbicularis oris, the muscle going around the lips, which means that this would have to be orbicularis oculi, and oculi for ocular, right, for the eyes. The orbicularis oculi also helps you blink. It helps your eyelids close to blink. So here are the muscles of mastication that I was mentioning before. Here's the temporalis, there's the T. Here's the M for masseter. And now we have the E for external pterygoid. Remember, external and lateral are synonymous. And then we have medial pterygoid, which is the internal pterygoid. And you should know them interchangeable because sometimes the test bank answers will show lateral pterygoid or sometimes external pterygoid. Maybe it's medial pterygoid or internal. If you can see, the medial pterygoid is internal. It's inside the mandible. We have to cut away the angle and ramus of the mandible to get a better look at it. And then here's the lateral pterygoid. Okay, now, the other reason why lateral pterygoid is called lateral and medial pterygoid is called medial is if you were to look at the image of the skull and you were to turn the skull upside down, you would see just posterior to the hard palate, there are medial and lateral pterygoid plates. And the medial pterygoid plate originates on the medial pterygoid muscle originates on the medial pterygoid plate. And the lateral pterygoid muscle originates on the lateral pterygoid plate. Okay, and these are involved with TMJD, right, with temporal mandibular joint dysfunction. I treat a number of patients. I treated one just the other day where I had to put my finger, with a glove of course, inside the patient's mouth, following the top of the maxilla right here and behind the last molar, and pointing with my digit superiorly, I could hit this muscle and do some release on the lateral pterygoid. When this muscle here is in spasm, it will restrict the jaw from moving side to side, or create TMJ, where when they open the jaw, it pulls to one side and they get this clunking type of feeling. All right, so here is, if you look at the maxilla, the one that's in alignment with the maxilla, right, parallel to it, that's the lateral pterygoid. And then the one that's moving on a diagonal, going from the angle of the mandible to the medial pterygoid plate, that's the medial pterygoid. The masseter is superficial. It follows the ramus and the angle of the mandible. And then there's your temporalis. So if we were to look at this one here, this one, I got news for you, it's none of these. Okay? It's none of these. This is a trumpet muscle that we call the buccinator. Like if you were to blow into a trumpet like this, and your cheeks puff out like a blowfish, that would be the buccinator or buccinator muscle. Now this one, on the other hand, if we take a close look, we can see there's bone here that's cut, right? So the mandible is cut here. So we can see this one is the medial pterygoid. This one up here is the lateral pterygoid. Do they give us, and you could see, look at the distractors. They give you lateral pterygoid and medial pterygoid, so you have to know the difference. Masseter, no, that's down here at the angle of the mandible, but it's cut. The buccinator, that's this one here. Temporalis, that's up here. Okay, so this would be the lateral pterygoid, that would be the medial pterygoid. And I put this one here showing you again a close-up view. Here's the mandible that's cut, and this one up here. Let me see if I could put the pen on again for you. Looks like it's on. So this one here, that's the lateral pterygoid, and then this one here, medial pterygoid. That is the buccinator. I'll put a B there for buccinator. Okay. This is the temporalis, occipitalis, frontalis, nasalis. Okay, there are a few other that we can see, and here I put the actions, what they do as well. So some muscles are like a sneering type of look, some is like grimacing, some do help you smile, and some give you a pouting look, you know, bringing your lips down, and that's your depressor, right? Depression, not smiling, but, you know, frowning. Labii means lip, and that's inferioris because it's inferior. This one, the levator anguli oris, levator, to elevate the angle of the mouth. Elevator or levator angulus oris, to smile, to lift that up. Levator labii superioris. Depressor anguli oris, that one's for grimacing. Depressor anguli oris. Now, this is the orbicularis oris from the side view. That's basically the muscle around the lips. I showed you the view of how it makes the circle around the lips from the anterior view. Here again is your temporalis, and then down below is the masseter. These are your muscles of mastication, masseter and temporalis, the T and the M. The orbicularis oris is important because that helps you manipulate food, right? To bring food into your mouth. Just like a horse. You ever see a horse when it kind of works on hay, it uses its lips to bring it in. And then we have our tongue inside the mouth right here. This is all tongue. Okay, now we're going to look a little bit at the neck. When we look at the neck, there are a few muscles I want to point out. One is the SCM, the sternocleidomastoid, named after its origin and insertion. So it's one of its origins is here at the sternum. The other is here. That's the clavicle or cleido. And then the insertion is up here at the mastoid process. So we call it the sternocleidomastoid, the SCM. Then we have another one called the Levator Scapula. And the Levator Scapula, we can see it right here in the middle picture. I'll circle it here as well. There's the Levator Scapula. So the Levator Scapula goes from the superior angle of the scapula, and it goes to the top 4 cervical vertebrae, C1, C4, transverse processes, the TPs, transverse processes of C1 to C4. And when the origin moves down here, it's going to shrug your shoulder, right? Like you say, I don't know. It's going to shrug your shoulders up. Levator scapula, elevate the scapula. Or the origin can stay still and then the insertion moves. And if that happens, now unilaterally on one side, that would be like holding a telephone next to your ear. So if you were like this and you tilted your head, that lateral flexion, the cervical spine, is what the levator scapula can do unilaterally. When it contracts bilaterally, it can shrug both your shoulders up. Okay, but you can only see that if you dissect and pull away the trapezius muscle, right? The trapezoid muscle, the trapezius, it looks triangular. And if you dissect that away, that's when you can see the rhomboid minor, which is here, and then the rhomboid major, which is here. Okay, so I'll put a capital M for major, and then a small m next to this one here. I'm just going to put an arrow there. That small m there for minor. Okay, all right. Now, so rhomboid minor, rhomboid major, levator scapula. Now, what else? Let's see if I can, let me go back one. Okay, I thought I can erase this, but I just don't see the eraser here. Okay. When we pull away the trapezius, you can also see some of the rotator cuff muscles. Now, this structure right here, which is the spine of the scapula, that is a landmark because above it is the supraspinous fossa, and that would be the supraspinatus muscle. Below the spine of the scapula is the infraspinous fossa, which is where the infraspinatus muscle originates. So those are 2 of the rotator cuff muscles, supraspinatus and infraspinatus. Okay, what else can we see here? We did some of the biggies. The SCM, levator scapula, rhomboid minor, rhomboid major. Again, rhomboid minor originates on the C7, T1 spinous process, and then rhomboid major, T2 to T5. But both of them insert on the vertebral border of the scapula. Okay. Let's go to the next one. So now here, we're looking at the person from the front, and here is a muscle that is going from the, looks like sternum, clavicle, and it's going behind the ear, which is where the mastoid process is. So we would call that the sternocleidomastoid. This one on the left side, on this person's left, because this is their left and this is their right. So when their left SCM contracts, it'll rotate the head to the right. That's when this one contracts. Okay? When the right one contracts, it'll rotate the head to the left. All right, now here, it's not asking what is the name of the muscle, it's asking what is the origin. So this takes us back to bones, bones, bones. So you'd have to say, all right, what bone is near the cheek? Oh, the zygomatic bone, that is the cheekbone. And that would have been the answer here. Okay, it's asking, it's a little bit cut off, but I'll read you the question. It's saying, what is the action of the levator scapula? So it's telling you the muscle that this is. Now, what's the action? Is it going to extend the scapula? The scapula can't extend. If you go and on YouTube and you look at some of my videos where I actually demonstrate the ranges of motion, the scapula does not extend. The scapula can elevate, depress, protract, retract, and it can upward and downward rotate. Okay, so what will the levator scapula, remember elevator? Well, last choice, elevate the scapula. Can't depress the scapula. That's going to be the lower fibers of the trapezius. Adduction of the scapula, that means bringing your scapula or the medial borders closer to the spine. Well, that's going to be your rhomboids and your middle fibers of the traps. Flexion of the scapula, there's no such thing as flexion of the scapula and extension of the scapula. It doesn't flex if it doesn't extend. So it elevates the scapula. What are they asking here? What is the insertion of the highlighted muscle? Okay, well, this is the levator scapula. And what I told you before was that it originated here on the superior angle, and it inserted on C1 to the C4 transverse processes. So C1 to C4 TPs, transverse processes. And again, when this one contracts, it will laterally bend or laterally flex your head. That's what they do unilaterally. Okay, so right here, that's what I put this here for you. Again, it's the levator scapula, and it's asking for its action. Does it extend? These are the possible choices. The only thing that it could do is laterally flex the neck, again, to one side, as if you were bringing your ear to your shoulder, as if you were on the telephone. Now we're looking at all of these muscles of the back. This whole group that's highlighted. What could it be? Well, we can rule out rhomboid major, we can rule out rhomboid minor, because those are going to be here, right? They go in this diagonal from the spine to the scapula. What about latissimus dorsi? The lats are the largest, widest muscle of the back. That's going to go from the ilium, the sacrum. It's going to go from the lower lumbars, the lower 6 thoracic vertebrae, and it's going to go this way, right? So the lats go this way. It looks like it's a back muscle, but its primary action is going to extend the shoulder, and it's going to adduct the shoulder. That's what the lats do. So it's not that. Splenius capitis. Well, capitis, capital, that's up here. The splenius muscles are only cervical muscles. They're up at the top. So by process of elimination, we figured out it was erector spinae muscles. Now on the opposite side of the trunk, Right on the anterior side, we're looking at the, well, here's the belly button. Well, what muscles are these? Hopefully you know this one. It is the Rectus Abdominis. These are linear fibers. They run up and down. And what do? They flex the trunk. Transverse abdominis? No. Transverse fibers go this way, transversely. External obliques? Well, oblique muscles run this way, or they run this way, those fibers. So what you're looking at here, these are obliques. These are external obliques. Then internal oblique would be deep to it, going that way. Diaphragm, can't see it. The diaphragm's deep, right? The diaphragm's going to go this way, but you got to be a lot deeper to see it. All right, so hopefully you would have gotten that one right. What is the action of the rectus abdominis? It flexes the trunk, right? It brings your upper torso downward like you're doing a crunch. All right, let's look at the eye muscles now. So the eye can move in many directions. It can go up, it can go down, it can go right, it can go left, it can go up and right, down and left, up and left, down and right. It can move in, it can create torsion. It can do a lot of different things. So 4 of the muscles, there are actually 6. So 4 of them are rectus muscles. They have the term rectus associated with it. Rectus, and then 2 of them are obliques. 2 of them are obliques. So the one here on top, right there, way up at the top, that's the superior rectus, which means the one way at the bottom, that's going to be the inferior rectus. Now let's say the nose is here. Okay, let's say here's the nose and then here's the other eye. Okay. So this medially is the medial rectus, and then the one on the outside is the lateral rectus. All right, so the rectuses are named by their positioning. Superior rectus on top, inferior rectus below, medial rectus closer to the nose, and then lateral rectus closer to the outside. That leaves us with 2 other muscles, the obliques. The superior oblique is on top, this way, and it runs here. It runs through this little notch called a trochlear. So it starts like this, runs through this little tunnel, and then comes in and attaches this way. The inferior oblique kind of does the same thing. It starts this way and goes underneath. So you have an inferior oblique on the bottom and a superior oblique on top. If we look at it from this view, that's your superior rectus. This one right here would be your inferior rectus. This one on the inside is your medial rectus, and this one on the outside is your lateral rectus. Okay. Now on the top, going through that trochlea, the pulley, that's your superior oblique. And then on the bottom, in this direction, that would be your inferior oblique. Let's look at the eye from this view. So right here, this is the ethmoid and the nasal bone, right? So we're looking at it from lateral to medial. That's the way we're looking at this. So this one up here on the top, superior rectus. This is the lateral rectus. So this one going through that tunnel, that's the trochlear. So this purple one here is going to be the superior oblique. On the bottom, inferior oblique. Which one is highlighted purple on the top? Well, I'm going to highlight the red one here going through the trochlear, that pulley, that's the superior oblique. On the bottom, inferior oblique. On the outside, lateral rectus. And on the top, the purple would be the superior rectus. Which one is this one on the bottom? The one on the bottom is going to be the inferior oblique. Okay, that one on the outside is the lateral rectus. This one is the superior oblique, and the one on top, superior rectus. That's straight. Doesn't make the curve. It's just straight. Okay. Let's look at the shoulder. Take a look at some of these. So when we look at the shoulder, we look at the chest from the front, this is a really neat view because we could see the superficial muscle around the outer part of the shoulder here. That is the deltoid. Then the next muscle close to the sternum here, right? We have the Pectoralis Major. Okay, so we have Pectoralis Major, and if there's a Pectoralis Major, there's going to be a Pectoralis Minor, but we can't see that unless we dissect and pull away Pec Major. All right. What else do we see here? I'm going to point to, let's look on the right-hand side where we can see the Biceps Brachii. Very important to know that there is a short head and there is a long head. Two heads, which is why it's referred to as the bicep, two. So the long head is a little bit more lateral, and the short head is going to attach to the coracoid process. So this one here is the short head. The long head goes through the bicipital groove of the humerus. And the bicipital groove is between the greater tubercle and the lesser tubercle. And between the two tubercles is this intertubercular groove or bicipital groove. It's this gap or this space. And that's where the long head travels. It goes right through the bicipital groove, and it originates on the top of the glenoid cavity. If you were to take the scapula, and let's say that was the glenoid cavity, there's a tubercle above it, and there's a tubercle below it. This is the supraglenoid tubercle, and down below would be the infraglenoid tubercle. But this would be the glenoid cavity of the scapula. That's where the head of the humerus articulates to make the glenohumeral joint, or the primary joint of the shoulder joint. Okay, so what does the biceps do, right? So the biceps crosses the elbow, and it is an elbow flexor, but it also supinates, right? If you were to put your, take your right hand and put a pen in there and pretend it's a screwdriver, if it's in your right hand and you're trying to tighten it, you would feel your biceps muscle contract. And when your bicep muscle contracts, that is called supination, right? When your hand is in the supinated position, holding sup, that is what the biceps brachii does. Not only does it flex the elbow, but it is a powerful elbow or forearm supinator if your elbow is bent at 90 degrees. If your elbow is bent at 90 degrees and you have a screwdriver, it's a lot easier to tighten something than if your elbow is held straight and extended while you're trying to tighten something. Okay? So that's why tightening something with the elbow bent, you have much more strength because you're recruiting the biceps brachii. If you straighten out the elbow, you take out the biceps brachii from doing the action, and you're working a very, very teeny weeny muscle called the supinator muscle. Okay? All right, also pay attention to this one on the upper right here called the subscapularis. Notice that the ribs are cut, and we can see the anterior scapula. And the fossa here that's on the anterior scapula is called the subscapular fossa. And there is a rotator cuff muscle that originates there called the subscapularis. So there are 4 rotator cuff muscles, and they are abbreviated SITS, S-I-T-S. The first S is for supraspinatus. The I is infraspinatus. The T is for Teres Minor. And then the last S is subscapularis, which is the one that I circled here. Okay, that's the subscapularis. And the supraspinatus originates on the supraspinous fossa. The infraspinatus originates on the infraspinous fossa. The subscapularis, which is this one in the picture, that originates on the subscapular fossa. Okay, so 3 of the 4 rotator cuff muscles originate on fossas. The supraspinatus, the infraspinatus, and teres minor, these 3 are going to insert on the greater tubercle of the humerus. And the subscapularis inserts on the lesser tubercle of the humerus. And all of the rotator cuff muscles are going to rotate, except for the supraspinatus. That one does not rotate the humerus at all. It really is designed to initiate shoulder abduction. And it's known to do maybe the first 10 to 15 degrees of shoulder abduction is created by the supraspinatus. And then the deltoids over here on the left side, the deltoid, especially the middle deltoid, does the rest of it. Okay, so that's a little bit about the rotator cuff muscles. And the one that's most commonly torn in people is usually the supraspinatus. They are very important muscles to help stabilize the glenohumeral joint. Why? Because the head of the humerus is much bigger than the glenoid cavity. And I've described it on one of my other videos as a golf ball, meaning the head of the humerus, sitting on a golf tee, which would be the glenoid fossa. Okay, let's move on. So now on this picture, we can see the deltoid again from this position. Here's the trapezius. Now, when you dissect the trapezius, on the right-hand side, we can see rhomboid minor and rhomboid major. With the trapezius also dissected, let's look at the supraspinatus and the infraspinatus. And where's our teres minor? Here is teres minor. It's this one here. So sit, S-I-T, is on the posterior. The supraspinatus is above the spine of the scapula. The infraspinatus is below the spine of the scapula. Teres minor, minors are always above majors, right? If you look at the rhomboids, here's rhomboid minor, I'll use a lowercase m. Here's rhomboid major, capital M. Look at the teres. Here's teres minor, small m. Here's teres major, big M. So the minors are always above the majors. So rhomboid minor just goes from, the rhomboids go from the spine to the scapula. The teres go from the scapula to the humerus. Okay, and teres minor and teres major are antagonistic to one another. Let me show you what their actions are. So supraspinatus, infraspinatus, teres minor, and subscapularis. Sits, S-I-T-S. If you write that down in order, the supraspinatus is going to externally rotate the shoulder. The infraspinatus will also externally rotate the shoulder. Oh, I'm sorry, my bad. Hold on, let me change that. The supraspinatus, remember we said the supraspinatus does not rotate. It's an abductor. So the supraspinatus abducts. The infraspinatus and teres minor, those two will both externally rotate the shoulder. So internal rotation, external rotation. The teres minor and the infraspinatus externally rotate the shoulder, and subscapularis will internally rotate the shoulder. So the only one that doesn't rotate is the supraspinatus. So supraspinatus abducts the shoulder, AB for abduction. The infraspinatus and teres minor will both externally rotate the shoulder, and then subscapularis will internally rotate the shoulder. Okay, and if you want to review those actions, go to my YouTube channel, the Nutrition Chiro Doc, and you can review what those actions look like. Okay, because it's important to visualize what the movements look like. All right, so again, to orient yourself, the trapezius is superficial, and if it's dissected away, that's when you could see these deeper muscles on the right-hand side, and there is your levator scapula. Levator scapula goes from the superior angle of the scapula to the top 4 C1 to C4 TPs. Okay. So what will the rhomboids do? What would these muscles do here, the rhomboids? The rhomboids are going to move your scapula inwards, which is called adduction of the scapula. Okay, that's what they do. The supraspinatus, infraspinatus, teres minor, you can review their actions: abduction, external rotation, and internal rotation. That is SITS. Okay, let's go on. Now, the last muscle here on the right, since we're looking at it from the posterior, that's the tricep. Tri means 3, and there are 3 heads. There is a lateral head, which is lateral, the long head, and the long head is the belly that pierces between teres minor and teres major. Teres minor and major are like 2 pieces of bread that are going to sandwich the long head. You can see the long head gets stuck. It pierces right between teres minor and teres major. So here's another beautiful view. If we look at the right-hand side, that's the posterior shoulder. So on the top is the supraspinatus. Then you have the infraspinatus below it. There's the infraspinatus. And then here's our teres minor. There's our T. So we have S, I, and the T. Where's the other S? That's on the anterior side. That's the subscapularis, which is anterior. Okay, so their actions are going to be the supraspinatus. The supraspinatus will abduct the shoulder. Abduct, when you're abducted by the aliens, it means you're taken away, right? Abduction. Then you have the infraspinatus and teres minor. Those are both externally rotate the shoulder. External rotation. And then the teres minor will internally rotate the shoulder. Internally rotate. Okay. So now let's look here. We're looking at a dissection. Here is the front of the chest. This is the large muscle called the Pectoralis Major, but it wants to know what is the action. So if a muscle is originating here, but is inserting here, when the insertion moves, it's going to bring the arm in this direction. So that's not abduction of the arm. It's not depression of the arm. There's no such thing. A muscle on the front cannot extend the arm. A muscle on the front has to flex the arm. Muscles on the back extend. So this is going to adduct the arm, right? So if your arm is out to the side, adduction is bringing it back to midline. Now, deep to pec major is where pec minor is. So pec minor is going to go from ribs 3, 4, and 5 to the coracoid process. Okay, so what's highlighted here? Well, it can't be the rectus abdominis, right? That's over here. Can't be pec major. That's superficial and it's large. Whoop, I'm sorry. I didn't see that. It can't be subscapularis because that's on the scapula. It can't be the internal intercostals. Those intercostal, those are rib muscles. Those are going to be the short ones here. It can't be serratus anterior because that's going from the scapula around to the ribs. So going from ribs 3, 4, and 5 to the coracoid process, that will be the pec minor. Okay, so this is the Latissimus Dorsi. You heard me mention it before. It's like the widest muscle of the back. It's going from the, it actually comes down here. You can see all of this white fascia. This is all part of the tendon. So all of this that we see here, this is still part of the lats. So it originates on the lower sixth thoracic, all of the lumbar, the sacrum, the ilium, and then it goes to the bicipital groove, which is in front of the humerus. That's between the greater and lesser tubercle of the humerus. So again, this looks like a back muscle, and it is, but its main action is to extend the shoulder and to adduct it. Like if you were doing a pull-up, the humerus or your shoulder is not just extending, but it's moving back to the midline of the body when you do pull-ups. That's called adduction. So it adducts the shoulder, and it's a powerful extender. If you're starting a lawnmower and you're pulling it, that's what the latissimus dorsi does. If you're doing a pull-up, that's the latissimus dorsi. Okay, what is the origin of the highlighted muscle? All right, so this is a muscle that's going from the spine to the vertebral border of the scapula. Well, this muscle happens to be the rhomboid minor. So what is the origin? Origin is C7 and the T1 spinous process. The insertion is the vertebral border of the scapula. Rhomboid major would be T2, T3, T4, and T5, so it would go in this direction. That's rhomboid major. The purple one is rhomboid minor. And again, when this muscle contracts, it's going to adduct the scapula, also known as retraction. Okay? And at the same time, because it runs on an angle, see how I kind of made these curved? The glenoid cavity or fossa will be pointing downward. As this side goes up, the other side goes down. So they also say it downward rotates the scapula. Okay, it's like a steering wheel, right? When one hand goes up, the other one goes down. Think of it that way. Okay, this one is the serratus anterior because we're looking at it from the front. You can see the rectus abdominis. We see the purple going to the ribs, but this is a muscle that originates on the posterior side. So if you were to see the choices, it would have been like latissimus dorsi, rhomboid major, pectoralis, or serratus anterior. It's the serratus anterior. And the muscle is going to insert, it's originating on the upper 6 ribs, but the insertion is on the scapula, but on the vertebral border. Okay, so when this muscle is weak, this is where the vertebral borders wing away from the rib cage on the back. They call it winging of the scapula. Okay, let's take a look. We already covered the biceps brachii and both the short head and the long head. Make sure you know the differences. On the posterior view, right, here's the supraspinatus. Here's the infraspinatus. Here is the teres minor. And here is the long head of the triceps. You see how the long head of the triceps pierces between teres minor, which is going to be here, and teres major, which would be underneath it. It's not showing it there. Okay? So on the upper right-hand side, you have the supraspinatus, the infraspinatus, and the teres minor. Down on the lower left, we're looking at the anterior forearm. Most of the muscles on the anterior forearm are going to flex your wrist or flex your fingers, which means the muscles on the posterior forearm are going to extend the wrist and extend the fingers. They're antagonistic to one another. So again, Most everything on the anterior forearm, right down on the bottom left, it says palmar view. Palm is anterior. And on the bottom right, it says dorsal view, which is posterior. So everything down here on the lower left, most of them are going to cross the wrist. So they're going to flex the wrist. Okay. There is this part of the bone right here is called the medial epicondyle. I'm just going to abbreviate it MEC, medial epicondyle. And on the lateral part of the humerus is the lateral epicondyle. So the brachioradialis originates on that lateral epicondyle, which is on the lateral side of the humerus. And these muscles here, like the Pronator Teres and the Flexor carpi radialis and Palmaris longus and Flexor carpi ulnaris, those are all going to have a common origin on the medial epicondyle, which is the medial part of the humerus. And clinically, these are important because you have people that get golfer's elbow. And golfer's elbow is if you were to take your hand and put your left hand over the inside of your right elbow and you squeeze your fingers, you're going to feel those muscles contract on the anterior forearm. Again, if you take your left hand, put it in front of your elbow, right in front of the crease of the elbow, but more on the inside, and you squeeze your fingers, you're going to feel movement there. That's because all of the wrist flexors and finger flexors originate off the medial epicondyle. And when that becomes overused, they call it golfer's elbow or medial epicondylitis. And from an improper or overused backhand, when you do a backhand and you extend the wrist, you're using all of the wrist extensors attached to the lateral epicondyle. So medial epicondyle, we're thinking flexors, and lateral epicondyle, we're thinking extensors. Okay, so everything on the right-hand side, like here, extensor carpi radialis longus, extensor carpi radialis brevis, extensor digitorum, all of those are going to originate off the lateral epicondyle, which is on the distal end of the humerus. Okay? All right, so let's go back here and let's see if we can retain some of that information we talked about before. So what is the structure highlighted? You should know that right off the bat. It looks like the Greek letter delta, so that is the deltoid. It can't be Pec Major, that's over here. It can't be Biceps Brachii, that's here. It can't be sternocleidomastoid, that's up here. And it can't be trapezius because that's posterior. What is the origin of the highlighted muscle? Okay, now even if you didn't memorize these, you could just look and go, all right, what do we have over here? Well, this is the lateral clavicle. I'm sorry, this is the medial clavicle. And over here, this is more lateral. And up here is the acromion process, right? It's that highest part. So let's see. It's asking for origin. So the origin is going to be up here somewhere, and the insertion is going to be down here. So can it be the radial tuberosity? Thanks for playing. Have a nice day. Is the deltoid tuberosity? Thanks for playing. Have a nice day. Right? The deltoid tuberosity is actually here. That's the insertion. Trochlea and capitulum of the humerus? No, that's way down here. So could it be anterior clavicle? Okay. Acromion? Yes. And spine of the scapula? Ding, 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 ding. That's it. That's the winner. All right, what are we looking at here? Let's see. Are we looking at anterior? Are we looking at posterior, right? These are the questions we have to ask ourselves. So here we're looking at it from the posterior. Here is rhomboid minor. Here's rhomboid major. Here's the vertebral border of the scapula. Here is the long head of the triceps. Here's Teres Minor. Here's Teres Major. Here's the spine of the scapula. So above it, right there, supraspinatus. Below it, you got it, infraspinatus. And what does it do? Well, the infraspinatus and Teres Minor, both of these are going to externally rotate the shoulder. So now what is the insertion of the highlighted muscle? Okay, so let's take a look. What are our options here? We have medial, we're looking for the insertion. Okay, medial border of the scapula. Well, medial border is here. Can't be that. Coracoid process of the scapula. Well, that's in the front. Can't be that. Infraglenoid tubercle. Can't be that. Greater tubercle of the humerus. Maybe. Let's see. Olecranon process? No, that's down here. So remember the supraspinatus, the infraspinatus, and Teres Minor all insert on the greater tubercle. And the subscapularis, the last one, inserts on the lesser tubercle. Okay? All right, let's see if we can figure this out. Here's the clavicle, here's the rectus abdominis, so this is the front. And we see a muscle back here in front of the scapula. Which rotator cuff is that? Subscapularis. Subscapularis. Okay, what's highlighted here? Biceps brachii. Biceps brachii. This is the long head, and this is the short head. Short head originates on the coracoid process. Long head goes through the bicipital groove, and that originates on the supraglenoid tubercle. So what is the action? Well, it's got a few actions. The action of the biceps here at the shoulder will flex the shoulder. What will it do here at the elbow? It can flex the elbow, but we said that it can also supinate the forearm. That's if your elbow is bent at 90 degrees and your right hand is tightening something. If you're tightening, that is supination. Okay, what is highlighted here? This is the long head of the biceps. The other one here would be the short head. So this one here that's highlighted, this is the short head of the biceps. The other one here is the long head. Okay, this is another elbow flexor. Now this is a shorter one, but it's very, very powerful. Is it the triceps? No, that's on the back. Is it the subscapularis? Nope, that's on the scapula. Is it the biceps brachii? Well, it's got two heads. It's not crossing the shoulder. Can't be that. Is it the deltoid? No. So you're left with the brachialis. Powerful elbow extensor. It's one of the few muscles that actually crosses the elbow as a belly of a muscle. Now we're looking at the posterior side. You could see the spinous processes here. We could see the Latissimus Dorsi here. We could see the Rhomboid Minor and Major here. So now what is the highlighted structure? Is it the deltoid? Subscapularis? Infraspinatus? No, infraspinatus is here. Biceps brachii. Biceps and triceps, right? Two antagonistic muscles. Since it's on the posterior side, it's got to be the triceps brachii. What is the action of the triceps? Well, it's a posterior muscle, so at the shoulder, it'll extend, and at the elbow, it'll extend. That's what it does. It crosses the shoulder on the foot, extends the shoulder, it crosses the elbow on the posterior foot, will extend the arm. What is this highlighted structure? Well, it's still the triceps, but tri means three. So this one here is the long head. This one here is the lateral head of the triceps. What is the insertion of this muscle? Well, we identified this before as the brachialis. And the brachialis, it originates here and inserts right there. What is it inserting on? Well, we could see the head of the radius is here. We could see the ulnar is here. So it's not the radial bone. It's actually on the ulna. And it's on the proximal anterior portion of the ulna called the coronoid process of the ulna. It's on the coronoid process, not coracoid, but the coronoid process. What is the action? Okay, so they're telling us that this is the brachioradialis. I call this the politician muscle. It is the only muscle in the body that goes from the distal end of one bone and goes to the distal end of another bone. It's going from the just above the lateral epicondyle. It's called the supracondylar ridge, supracondylar ridge, because it's above the lateral epicondyle, so it's like right there. And it inserts on the styloid process of the radius. So it's called the brachio for brachium, arm, and then radialis because it attaches to the styloid process of the radius. It is an elbow flexor. That's what it does. It is a main elbow flexor, but it does so from the neutral position, which is the handshaking position. That's why I call it the politician muscle. The biceps brachii does it from the supinated position. Elbow flexes from supinated position. The brachioradialis flexes from the neutral position. And the brachialis is strong, flexing the elbow from a pronated position. What is the origin of the highlighted muscle? Okay, so you heard me talk about the origin being here on the humerus near the supracondylar ridge at the lateral epicondyle and the insertion here. So what's the closest answer to it? Could it be the greater tubercle? Nope, not even close. Lesser tubercle? Nope, wrong species. Head of the radius? Nope, radius is forearm. This originates on the humerus. Olecranon of the ulna? No. Shaft of the humerus, because the supracondylar ridge is part of the shaft of the humerus. Okay, what structure is this? So we're looking at, so here's the thumb, here's the medial epicondyle, and here's the lateral epicondyle. We know that this is lateral because here's the thumb is lateral. There's a very short muscle here called the supinator muscle. It originates on the back of the elbow and it wraps around to the front. And it supinates like you're holding soup in your hand. That's the supinator. What is the action of the supinator? Oh, come on, that's silly. That's a giveaway, right? The action is it's going to supinate the forearm or supinate the hand. That's the action. What is the insertion? Well, what you heard me say before was the origin was back on the posterior side and the insertion is on the front of the radius. So let's see what we have here. Ulnar tuberosity? No. Radial head? No. Radial head is up here. Styloid process of the radius? That's down here. Olecranon process? No, olecranon is on the posterior part of the ulna. So it's the shaft of the radius. Best answer. Shaft of the radius. Here's the thumb. So this is the lateral epicondyle. That's the medial epicondyle. The muscle that goes from the medial epicondyle and goes to the lateral side, that is the pronator teres. Pronation. So the supinator supinated the hand. The pronator teres will pronate the hand or the forearm. Supinator, pronator, right? Those are going to be antagonist muscles to one another. Okay, now we're looking at the posterior part. So when you're looking at actions based on the general rule that I said before, anything on the front is going to flex and anything on the back has to extend. So if it's on the back of the hand, it's got to extend the hand or extend the wrist or extend the fingers. So what are choices? Is it going to abduct the fingers? That can't be abduction. Is it going to extend the little finger only? Well, no, it goes to other fingers. Is it going to abduct the hand? No, abduction would be if the belly was on the radial side. Is it going to extend the thumb joint? Nope, doesn't even attach to the thumb. So the only answer is it's going to extend the wrist. If it crosses the joint, it's got to act on the joint. So it's going to extend the wrist. If it crosses the fingers, digits 2, 3, 4, and 5, it has to extend the digits as well. So this muscle is the extensor digitorum muscle, and it extends the digits and the wrists, both. Okay, this one, a little bit tough to see. You may want to look this one up in the book, but along the lateral side, on the thumb side, there's two muscles. One is called the extensor carpi radialis longus and extensor carpi radialis brevis. So this one here is the extensor carpi radialis brevis. And again, if you see two of them in a choice, you know they're going to be asking, it's probably going to be one or the other. That's just how tests go. They're challenging you on it. So ECRB, extensor carpi radialis brevis. So it's on the extensor side, it's on the posterior side, it crosses the carpal bone, it's on the radial side, and brevis because it has a short tendon. Longus has a longer tendon, and it's going to go further down to the thumb. Okay, this is the posterior forearm. This is the posterior side, so it's an extensor. And you need to review the extensor carpi ulnaris, and then there's an extensor carpi radialis. Okay, there's also a flexor carpi ulnaris and a flexor carpi radialis. Okay, so these two are on the anterior side. Flexor carpi, they cross the wrist. One is on the ulnar side and the other is on the radial side. The extensors, remember, the extensors are going to be on the posterior side. So it's going to cross the carpals. One is on the ulnar side, the other is on the radial side. So here's the thumb, right there. So the thumb is on the radial side, can't be that one. Here's the pinky, it's the ulnar side, that's the extensor carpi ulnaris. Okay? Okay. Let me go back here. Let me just make sure I heard something ding. I just want to make sure no one was trying to reach out there. Oh no. Okay. Can you hold on? Were you able to see the screen at all? What was the last thing that you were able to see on the screen share? Oh boy. I wish you would have I wish I would have heard you. What was the last thing that you saw? And then I can go back. I don't know why that was. So you were able to see it up until about 15 minutes ago. Let's go back here. Let's go back to the screen share. I cannot see, that's the problem. When I'm on a PowerPoint, I can't see anything that you're texting because my full screen is my PowerPoint. 15 minutes is a long time. Okay, I'm going to have to, can you see my screen now? Okay, I'm just going to start where I left off, and hopefully it was just at your end and then it recorded it. Hopefully. Okay, you can still see my screen. Great. Okay. If you can't, unmute yourself because I can't see anything that you're texting at this point. All right, so let's go back here very quickly and go through this again. This was the triceps brachii. This is the long head. This is the lateral head. This is the brachialis. The insertion we said was here on the coronoid process of the ulna. This is the brachioradialis. It originates on the shaft of the humerus and inserts on the styloid process of the radius. This is an elbow flexor. That's what it does. This is the brachioradialis once again, and it's asking for the origin of it. And the origin is on the shaft of the humerus. The insertion is on the radial styloid. This is the supinator. The supinator is antagonistic to this one here, which is the Pronator Teres. So the supinator is purple. The supinator originates on the posterior part of the radius, and it inserts on the anterior part. It actually inserts on the posterior part of the humerus, but way back here. And it wraps around and attaches to the shaft of the radius. So what is the insertion of this muscle? So again, it's pointing to the supinator and it's asking for the insertion. So that it can't be styloid process because that's down here. It can't be radial head. It can't be ulnar tuberosity. It can't be olecranon process because the olecranon process is posterior. It's got to be shaft of the radius. This is the Pronator Teres. We said anything on the posterior wrist is an extensor of the wrist and also an extensor of the fingers if it crosses it. So since these cross the fingers and it crosses the wrist, this happens to be the extensor digitorum muscle. It extends the wrist and it also extends the digits. So you can rule these out. When you look at abduction of the fingers, no. Extension of the little finger, no. Abduction of the hand, no. Extension of the thumb doesn't even attach to the thumb. So by process eliminate, figure that out. Okay, what I said before, make sure you review the difference between ECRL and ECRB, the extensor carpi radialis longus and extensor carpi radialis brevis. Brevis has a shorter tendon. Longus is going to have a longer tendon. So just make sure you know the difference. This is the extensor carpi ulnaris. There is an extensor carpi radialis. There is a flexor carpi ulnaris, and there's a flexor carpi radialis. So the extensors are always on the posterior side. The flexors are always on the anterior side. So if we're looking at the posterior here, this is the back of the hand, and this one is crossing the carpals, and it's on the ulnar side because this is the pinky. Here's the thumb, so this is the radial side. If it was a belly that was on this side, then it is the extensor carpi radialis. Because it's the belly on the ulnar side, it's extensor carpi ulnaris. If it was on the flexor side, on the anterior part of the forearm, then it would be flexor carpi ulnaris. If it was on the ulnar side, and if it would be a flexor carpi radialis, it has to be anterior, crossing the carpals on the radial side. So you have to talk yourself through it. Okay, looking at the thigh, looking at the anterior thigh, muscles that you should be familiar with, Psoas major, iliacus. Both of those are very strong hip flexors, like taking a first step, right? When you're taking a step or you're walking up the stairs, your hip has to flex. Another muscle you need to know for sure, TFL, which is tensor fasciae lata. You're going to see the pectineus, which is here. You're going to see the adductor longus. You'll also be able to see the gracilis, which is a medial muscle. Sartorius, which is the longest muscle in the body. The gracilis, so sartorius is the first longest muscle in the body. Gracilis would come in second place. Then you have the quadriceps in the front. The quadriceps are 4. We have the rectus femoris is 1, vastus lataris 2, vastus intermedius 3, and vastus medialis 4. So these 4 are your quadricep muscles. They are very strong knee extensors or leg extensors. On the posterior side is where we have our hamstrings. And the hamstrings are only 3. There's the bicep femoris 2. I'm sorry, the bicep femoris has 2 heads, a long head and short head. And then there's the semisisters, the semitendinosus and semimembranosus. So there are 3 hamstrings. I'll put an H for hamstrings. But there are 4 quadriceps. We'll put the Q there for 4. The one that's lateral is the bicep femoris. The 2 that are medial are the semitendinosus, semimembranosus. They're medial thigh muscles. Then we have some gluteus muscles up here on the top. And the glutes, we have to cut the gluteus maximus, which is a large tush muscle, right? It's the rump muscle. We cut the gluteus maximus so that you could see the gluteus medius, which is just deep to it. And if you cut the gluteus medius, you could see the glute minimus. Then we have our infamous sciatic nerve right there. Why is the sciatic nerve important? Because it's the landmark. Right above it is the piriformis. And there are 6 deep lateral rotators. Piriformis is one of them. They're called please, go, quietly. Those are the 6 deep lateral rotators. Piriformis, gemellus superior, obturator externus, gemellus inferior, obturator internus, and the Q is for quadratus femoris. Yes. So please go quietly. P is for piriformis. Many people get piriformis syndrome, which is a cause of sciatica. And then you have 2 gemellus muscles, gemellus superior, gemellus inferior. You have an obturator internus and an obturator externus. Okay. All right, let's take a look here. I want to get moving because I know it's getting, we're on here for quite a while. So here is the anterior part of the pelvis. This is the iliac crest, iliac crest. Here is L3, L4, it looks like, and L5, and then these are your discs, just to give you an idea what we're looking at. So This is the iliacus muscle, and the one here is psoas major. So that's the iliacus. Psoas major is the other one here. These are your primary hip flexors. So this purple one is psoas major, but here it's asking what is its action. So its action, is it going to abduct the thigh? No. Is it going to depress the thigh? No. Is it going to extend the thigh? No. Is it going to elevate the thigh? No such action as elevation. Flexion, extension, abduction, adduction, those are reasonable actions. So that's your primary hip flexor. So that's the best answer. TFL, this is your Starbucks muscle. This is your tensa fasciae latae, tensa fasciae lata muscle. It's not gracilis. Gracilis is here. It's not your sartorius. That would go here. And it's not your quadriceps femoris, because those are the four muscles in the front of the thigh. Here is the longest muscle in the body. Remember, your TFL is here, tensa fasciae lata. Gracilis is here. Pectineus is here. Adductor is here. So this is your sartorius, longest muscle in the body. It goes from the anterior superior iliac spine, and it goes right to the inside of the knee. What is this structure here that's highlighted? It's the purple area right there. That's going to be the gracilis. What are they asking for here? This is going to be your pectineus muscle. Gracilis, no. Adductor longus, that's going to be this muscle here. I'm sorry, let me go back here. My bad, my bad. Let me take another look at this picture. Okay, so this one here in red would be your adductor longus. This is not the pectineus. The one in the purple is the adductor brevis. It's a shorter one. So this is adductor brevis. This one is your adductor longus. Pectineus is a little bit higher. It's shorter and would be here. So what is this structure highlighted? This one is going to be the pectineus. Okay. This one here, gracilis. This one here, sartorius. And then the four in the front would be the quadriceps. Now we're on the posterior part. Now they're asking, this long muscle on the back is the gluteus maximus, and it's asking us for its insertion. Now the insertion has to be somewhere on the humerus, okay? Not humerus, the femur. It's got to be somewhere on the femur. Now ischial tuberosity, that's here. Iliac crest, that's up here. Pubic crest, well, that's got to be somewhere in the center. Iliac fossa, well, that's on the anterior side. That's where the iliacus originated. So the best answer is going to be the gluteal tuberosity of the femur, and that's where the gluteus maximus will insert. And that's a hip extensor. It's a major hip extensor. Now, when we take this muscle, the gluteus maximus, and we remove it and cut it, we can see the gluteus medius, which is deep to it. Okay, that one's going to insert on the greater trochanter, but that's the gluteus medius. Let's skip this one. It's a little bit hard to see. It's asking for the proximal attachment of this muscle here, and it's going to be the ala of the ilium. A little bit hard to see, so we'll skip that one. When the gluteus maximus is cut, look at here. Here's the sciatic nerve. I said that is a landmark. That is a landmark. because the muscle above it is the piriformis. A lot of runners get piriformis syndrome. When this muscle is in spasm, it hits the sciatic nerve and gives you sciatica. That's one of the causes. Remember I said, please go quietly? And I said those are the 6 deep lateral rotators or external rotators of the hip. So piriformis is one of them. That's the highest one. That's this one. Then we have a gemellus muscle, which is here. That's the gemellus. Here is the quadratus femoris, the one all the way on the bottom. It's this one. Now we're looking at the posterior part of the femur. So when you think back here, we're thinking hamstrings. So when you're thinking hamstrings, we know that there are only 3 of them. We know that there's 1 on the lateral side, and we know that there's 2 on the medial side. The 2 on the medial side are the semi-sisters, semi-tendinosus and semi-membranosus. The bicep femoris is the only one that's on the lateral side. And bicep, remember it's the bicep femoris, it means 2 because there's a long head and there's a short head. This one is shorter, so it's the short head of the bicep femoris. The long head right up here at the ischial tuberosity. Okay, now this one, what is the insertion of the highlighted muscle? Now this is going to be one of the hamstrings. Now, whether it's the semimembranosus or tendinosus, it doesn't care to ask you that. It wants to know the insertion. So the insertion looks like it's here on the inside of the tibia. Here is the fibula. So is it the head of the fibula? No. The head of the fibula is where the long head and short head of the bicep femoris will attach. That's lateral. So the medial attachment is going to be on the medial condyle of the tibia is the best answer. What muscles are on the front of the thigh? Those are going to be the quadriceps, but it's asking what is the action of the quads. So they're going to cross over the kneecap. They're going to cross over the patella, and they're going to attach right there to the tibial tubercle as part of a tendon. So they're going to all extend the knee or extend the leg. And again, the 4 muscles, there are 3 of the vastus brothers that I call them. And the 3 vastus means immense. There's the vastus medialis, the vastus lateralis, and then if you cut a hole through the center, the vastus intermedius, and then there's one that crosses 2 joints called the rectus femoris. Rectus femoris originates up here, it crosses the hip, and inserts here. So all 4 of them cross the knee. Only one of them crosses the hip, and that is the rectus femoris. So that means that the rectus femoris can flex the hip joint as well. Okay, so think of a person doing a hurdle. If they're running and jumping over a hurdle, all 4 quads will contract to extend the knee, and one of them will extend the hip. And that's the rectus femoris. Okay, what structure is highlighted? This one up here is going to be the adductor brevis. This one here would be, adductor brevis. This one is the adductor longus. This one here is going to be the sartorius. Again, so this one here is the adductor brevis. This one here is the adductor longus. This one here, gracilis. Okay, we're almost at the tail end here. We're looking at the leg. So when we look at the lower leg, similar concept to the wrist. When we talked about the wrist, anything that crossed the wrist was on the anterior forearm. So the anterior forearm muscles flex the wrist and flex the fingers. The posterior forearm muscles extended the wrist, and extended the fingers. So the same concept applies to the leg. There are muscles that are in front of the leg that will cross the foot. So when these muscles of the anterior compartment of the leg, especially the Tibialis Anterior, this one here, which comes around to the inside, that one is a major dorsiflexor. Dorsiflexion. So the foot can dorsiflex and it can plantar flex. Dorsiflexion is when you're walking on your heels. Plantar flexion is when you're walking on your toes. So all of the anterior muscles will dorsiflex. And all of the anterior muscles that cross the dorsum of the foot will extend the toes. So this muscle here is extensor digitorum longus, and if you look at the tendons, here are the tendons, they cross the toes on the top of the foot. So the extensor digitorum longus, since it crosses the ankle, it'll dorsiflex the foot, and since it crosses the toes, it'll extend the toes. The muscles on the posterior side do the opposite because they're antagonistic. So the posterior muscles like the gastrocs, the soleus, your calf muscles, will plantar flex the foot and plantar flex the toes. Okay? So the tibialis anterior is a biggie in the front, so is the extensor digitorum longus. Okay, so this one right here on the front of the foot, coming around this way, that's your tibialis anterior. That's a dorsiflexor, and because it attaches to the inside of the foot, they call it inversion. Inversion of the foot. Okay, that's inversion. You know when you slip down the stairs and your foot rolls in, that's inversion. When that happens, you damage all the ligaments on the outside of the ankle. So here's the posterior leg. Here's your gastrocnemius. Now notice the gastroc has two heads. It's got a lateral head and it's got a medial head. And they both cross the knee joint. So both of them are going to originate on the femur, but on the condyles of the femur. So the lateral head will originate on the lateral condyle of the femur. The medial head will originate on the medial condyle of the femur. So the gastrocnemius crosses the knee, but it also crosses the foot because it attaches right here, the Achilles tendon. The Achilles tendon is a tendon that comes off of the gastrocs and the soleus. Both the gastroc and the soleus come down and they make up this Achilles tendon. It's the most common tendon in the body to rupture. Okay, the most common tendon in the body to rupture. And what is the name of this bone, this heel bone? That's the calcaneus. So when this muscle contracts, it's going to allow you to step on your tippy toes. That's called plantar flexion. Plantar flexion. On the outside of the leg, you see there's a fibularis longus and there's a fibularis longus, which is superficial, and then there's a fibularis brevis. It's a little bit tougher to see. But those go right posterior to the lateral malleolus. See that? So here is the brevis. It's going to go and attach right there. Longus is going to go underneath the foot, completely underneath the foot. It's a lateral leg muscle, but it goes under the arch of the foot and attaches to the pinky toe side. My bad. Let me say that again. The fibularis longus is a lateral leg muscle, goes behind the lateral malleolus, down the outside of the foot to the inside, to where the first metatarsal is, the head of the first metatarsal. Okay. the Fibularis Longus, which is a lateral muscle, goes under the foot to the inside, underneath but to the inside, has the same attachment as the Tibialis Anterior, except I could draw it better here. So the Fibularis Longus comes down like this, goes underneath like a stirrup, and attaches there. The Tibialis Anterior is really an anterior muscle, comes up like this. But they both invert the foot. Okay, so let's go back here. So what is the action of the gastroc muscle? This is a posterior leg muscle. So it crosses the knee and it crosses the ankle. So do we see any ankle actions here? Nothing. They're all leg. They all have the word leg in it. So since it's a posterior muscle, it's going to flex the leg. Flexion of the lower leg. Extension of the leg? No chance. It's got to be an anterior muscle for extension. Those are the quads. The quads will extend the leg. What is the origin of the medial head? So what is the origin of that head? Well, medial is the key word. Medial condyle of the femur. If it asked you what is the origin of the lateral head, then it will be the lateral condyle of the femur. And then once again, look at your two distractors. They're opposites. Usually it's one of them. Okay, what are we looking at here? This one looks like it's going to, it's a fibularis muscle. So we can cross out tibialis anterior, we can cross out the soleus, and it's pointing to the outside of the foot. It's not going under, so this is going to be the fibularis brevis. When we go back here, if we take away and dissect all of these, the posterior compartment, we're going to be looking at deeper bellies, which is this, the popliteus, the tibialis posterior, flexor hallucis longus, and flexor digitorum longus. So similar concept to, remember what we said of the forearm, flexors are on the anterior, extensors are on the posterior. When we talk about the leg, the extensors are on the anterior leg, the flexors are on the posterior leg. So that's why we see on the posterior side a flexor hallucis going to the great toe and a flexor digitorum going to all the other toes. So they start on the back of the leg and then they go underneath the foot. So this one here, back of the knee, this is your tibialis posterior. It's behind the tibia bone and it's posterior. Here, I wouldn't worry too much about this one. I think it's a poor view, a pretty poor view. But this one here is going to be the flexor digitorum longus. Tibialis posterior is more central, and then the flexor hallucis is going to be out here and coming in. So again, here's the great toe. So the inner one is the flexor digitorum. The most lateral one here is the flexor hallucis, and the one right in the center is the tibialis posterior. Those are all going to cross the ankle on the posterior. They're all responsible for plantar flexion. Anything on the posterior compartment of the leg, plantar flexes, all of them. And they're all going to flex the toes. Okay, so what are they asking here? What structure is highlighted? Let's look. Lateral malleolar tendon, no such species. Medial malleolar tendon, no such species. Popliteal tendon, nope. Plantar fascia. Now, the plantar fascia is underneath the foot. Calcaneal tendon is the other way of saying Achilles tendon. They're interchangeable. What is the insertion? So now they're asking, what is the insertion of the Achilles tendon? What's the name of that bone? the calcaneus. It's not the lateral malleolus, that's here. It's not the medial malleolus, that's here. And it's not the navicular, that's an odd bone. And what's it saying here? What is a unique characteristic of the feature of this muscle? So they're looking at this purple muscle here. Now, even if you didn't know the name, it's not really asking it. It's just showing that this muscle is originating and inserting on tendons of other muscles. And that's a pretty rare finding, to have a belly of a muscle that originates on a tendon, which we see here. It originates on a tendon and inserts onto other tendons. It's just odd that you're going to find that. So sometimes I like to ask these weird, unique things. Okay, let me stop the recording here, and then I'll be happy to take any questions.